right, thank you so much, Reverend Arvin, for the wonderful talk. And I want to say I'm always so in awe of chaplains and everything they do. So thank you for sharing that. So the speakers before me gave an excellent sense of what ethical dilemmas and struggles are, and how we can provide support in those kinds of situations. My talk is about another practical resource offered at Norton Healthcare to help deal with ethical problems that clinical teams and patients encounter. So I'm a new clinical ethicist at Norton Healthcare and an assistant professor in the Department of Philosophy at the University of Louisville, where I teach healthcare ethics in their graduate program. My goal today is to make you aware of what a clinical ethics consultant does, so that if you ever find yourself in an ethical dilemma in the hospital, you know who you can reach out to assist you. So I'm going to start from kind of the most abstract concepts and move closer and closer to practical steps. I'll first touch on how ethics consultation can be helpful, even if you know that the situation may be unresolvable, as it is with moral dilemmas, and if you feel you already know what the right thing to do is. I will then walk us through the process of an ethics consultation, which might be unfamiliar to many of you, and I'm going to highlight how to contact the ethics consultation service. Finally, I'm going to come back and apply some of these steps to the case Dr. Brothers opened with about the little boy without a legal guardian. So, how can an ethics consultation help? Well, let's first talk about what an ethics consultant is. An ethics consultant is often someone who already has a professional role in the hospital, such as a nurse, a chaplain, a physician, who is available to serve as needed as the main person to run an ethics consult. These people will likely have completed additional training in healthcare ethics consultation, which means they've covered ethical theory, mediation techniques, collected many hours of experience in managing ethical situations. And then there are certified consultants like me for whom ethics consultation is their primary job. And they might have a background in something non-medical like philosophy, bioethics, or religious studies. Ethics consultants are trained to manage a range of ethics issues that arise regularly in a clinical setting. So here's a few key ones, and I'm going to discuss some examples. So surrogate decision-making comes up all the time. So suppose you have a patient who's been living with their partner for 15 years and who's now making end-of-life decisions for them in the hospital. When suddenly the patient's wife from 20 years ago shows up, and you find out they never got a divorce. So these are all true examples. I've adjusted some things, but a lot of them unfortunately deal with family drama. So legally, the question might be clear. And in this case, legally, it was the wife from 20 years ago that had the authority, unfortunately. But ethically, it might not be appropriate to let the estranged wife make all of these decisions. So an ethics consultant can try to help find a middle way to have both parties work together and put the patient's wishes and values at the center of any medical decision. Now, if you would like to handle this by yourself, I mean, you are permitted to, but also you can call us and we can try and assist in that kind of management. Another common dilemma is what to do with a patient who is confused and lacks capacity to make good decisions for themselves, but is adamantly refusing life-saving treatments such as dialysis, which they need to survive. So if you and their surrogate override their refusal and force them to have dialysis, you could cause them a lot of harm and distress. And in any case, it wouldn't make a very good long-term strategy, right? Because they would require this for a lifetime, or at least for the rest of their life. But on the other hand, you and their surrogate might agree that they would benefit from the treatment, and if they were thinking clearly, they would want it. Well, if you consult with the consultant, you might be able to help. We can help you find the best way forward. So I've encountered these situations several times, and each case is a little different. In one situation like this, I recommended that we do 1 or 2 sessions of the dialysis to help clear the patient's mentation, because it was thought that their lack of capacity was related to the fact that they had missed some dialysis sessions. In another situation, the refusal was more long-term and related to a kind of psychosis this patient had that wasn't going to be alleviated by forcing them to have dialysis. But instead, what we did was wait until the patient felt unwell enough due to the toxins building up in their body, and then they stopped refusing the dialysis and assented to the procedure. So probably the most common thing we get called for is non-beneficial, or what used to be called futile treatment. So this is when families, on behalf of the patient, request treatment that's unlikely to change the outcome and indeed might simply be burdensome or painful for the patient. These situations can be very stressful for the clinical staff because they are the ones who are responsible for continuing to do things to the patient that they feel is not right. Our hospital has a policy in place to help deal with these situations called the non-beneficial treatment policy, which the ethics consultant can help walk the team through, which always starts with a joint meeting to ensure that families and teams' perspectives have been voiced. And in my experience here at Norton Healthcare, incredibly, this just joining together and having this conversation has managed to alleviate the situation and find a resolution that both team and family are happy with. An issue that is a little less common but hard to navigate is issues around truth-telling and disclosure. You might have parents who want to protect their child and do not want to disclose realities about their child's condition that you think the child ought to know. Or you have patients that come from a culture where patients would prefer not to be told about a negative diagnosis such as cancer and would prefer for their family to make all of the decisions for them. But this might conflict with your professional obligations to disclose things to your patient. And because medical care is supposed to be patient-centered and respectful of what patients value, this creates a genuine dilemma for the staff that hopefully the ethics consultant can help you resolve. I also had a case of that, but I won't get into it now. You can ask me after. So this is just a brief selection of issues that the consultant can help with. In addition to this work, they create education for staff if they notice an issue keeps repeating itself. So for example, at a previous institution where I worked, we noticed that physicians were delaying pronouncing patients dead because there was confusion around whether or not they needed consent from family to do an apnea test for determining death by neurological criteria. Through targeted education, once we found out that this was a common issue, we did targeted education on their unit, and we were able to clarify the hospital policy, which stated that consent was not required. And this cleared up many misunderstandings. And we were also able to help them realize that there can still be judgment and exceptions made depending on the family's circumstances. So a substantial goal of any ethics service in a hospital is to reduce or prevent issues from arising in the first place. And what we want to do is give the clinical staff those tools that they need to do that. Ethics consultants can also help after the fact, after a case has happened, by helping staff deal with moral distress. So one of the most common definitions of moral distress is when you know what the right thing to do is, but you are restrained from doing it. So for example, there are often legal restrictions in place that are intended and often do protect vulnerable patients, but sometimes, like in the case Dr. Brothers has mentioned, they can cause undue suffering for a patient. And staff who are subjected regularly to moral distress perceive their job as more stressful and are more likely to burn out, which is a significant concern both for the hospital and for society in general. One way that an ethics consultant can help with this is by doing debrief sessions after stressful cases where staff are invited to share their experiences and frustrations with the consultant and other support staff that can assist them. The importance of the involvement of ethicists became very clear in policy development during the pandemic, when hospitals had to develop policies around how to allocate limited resources and manage vaccine mandates for their staff and patients. And these kinds of issues can benefit from the expertise of clinical ethics consultants, given their practical and theoretical training. And to that end, many ethics consultants like myself do research, publishing recommendations, or observations about ethics issues they encounter in the clinic. Ethics consultants can also be helpful when there have been miscommunications, feelings of broken trust, or high tensions between staff and family, between family members, or between staff. As such, they can serve as a significant mediation role. Ethics consultations are free and can be requested by anyone, including a patient or family member. Lastly, I want to dispel any myths that ethics consultants are like the ethics police. Their involvement does not signify that someone is in trouble or that someone has done something wrong. In fact, in my experience, most ethics consultations are initiated by physicians themselves who have a good sensitivity for ethics issues and just want to ensure that they are doing the best by their patients and the best by their team members. Okay, so now you may be thinking to yourself that this is all fine and good, but you don't really need an ethics consultant because whenever you encounter ethics issues in practice, you feel you can handle them yourself. You are a very ethical person after all. Here, I want to convince you that even if you do have all the right answers, requesting an ethics consult can still be beneficial. Now, first, let me say that, as been sort of suggested earlier in the other talks, that ethics consultants are not gurus with all the answers about what is good. And there can be reasonable debates about these issues, and different ethics consultants may handle cases differently or make different recommendations. Nor will there always be a good solution, right? Genuine moral dilemmas will not be solved via consultation in the sense of bringing about a solution with no downsides. But what characterizes an ethics consultation is that it is process-driven. In other words, it's not about guaranteeing an outcome, such as ensuring the family agrees with the medical team, but it's about ensuring that the team has asked the right questions, talked to the right people, and taken the right steps to foster a decision that places the patient's values and interests first. I like to make the analogy to medicine. The standard for practicing medicine well is not measured by being able to save every patient. Rather, what matters is that you followed and exceeded the standard of care. You were thorough in your assessment. You paid careful attention to your patient, developed a therapeutic relationship with them. You used up-to-date knowledge in ensuring that you found the best available options for them, and you had enough humility to seek a second opinion when you felt uncertainty. Sometimes you do everything right and patients still die. Similarly, sometimes we do everything right and ethical issues persist. But it is helpful to know that the ethical dimensions of the situation have been carefully looked at by someone with experience and who may have a fresh set of eyes on the problem. Not only that, but the introduction of an outsider is sometimes a significant catalyst in a situation that may have seemed to have stalled. Sometimes patients or families just need to hear the same message in a different way or from a different messenger. Ethics consultants often use structured family meetings to bring together different teams and family members so that everyone can get on the same page, rather than receiving information piecemeal or via a game of telephone. Clarifying these issues earlier on can prevent a situation from becoming ethically intractable. As you can imagine, when done well, this has potential to save the medical team a lot of time and to maximize the chances that medical treatment aligns with what the patient would want for themselves. Ethics consultants can take that extra time to find out what is important for a patient in order to help the team and patient make a shared decision about appropriate treatment goals. Indeed, studies have shown that proactive consultation with an ethics consultant for patients in the ICU and in the hospital were able to considerably reduce length of stay and the use of mechanical ventilation while maintaining the same mortality rate. In other words, ethics consultation can help prevent the initiation or prolongation of treatments that do not benefit patients. There is also evidence that using an ethics consultant can reduce moral distress, which I mentioned earlier. So suppose that an ethics consultant gets involved in a tricky case, but the outcome is identical to what would have happened without them. Nevertheless, the medical staff may overall feel better in the scenario involving the ethics consultant, because what is different is that their observations are heard, that their distress and the root of it is acknowledged. They feel that all the relevant ethical options have been considered. And I think importantly, they feel that the weight of the moral burden has been shared. That is, they have support from others that the decision that they have to make is the right one. When medical staff have their moral distress acknowledged and managed, they are less likely to burn out and to find their jobs so stressful that they have to quit or take leave. And so the ethics consultant can provide an extra form of support via their process, even when the outcome is the same outcome that would have occurred without their involvement. Okay, so hopefully I've convinced you of the benefit of ethics consultants. So suppose next week you find yourself in a situation that could use input from an ethics consultant. What would that look like? Well, the ethics consultant, who will be working in tandem with other colleagues from the ethics committee or other relevant parties, such as the legal team, will reach out to you for more information about the situation. In person or over the phone, they're going to gather information about the patient and what seems to be the precise ethics question. When it is appropriate, they may speak with families or patients, trying to get the perspective of each party. Oftentimes, what initially seems to be the problem turns out to be a miscommunication, but a different related problem becomes apparent. So, for example, I had a case where the team believed that the family member was prolonging the patient's painful dying process because of indecision. But after speaking with the family member, I found out that the family member and patient had made a pact. They'd made a promise to be there for each other in the event that one of them was dying. And the real reason the family member wanted to prolong treatment is so that the family member could make it to the patient's bedside and fulfill that promise, but they were being delayed due to personal issues. So these are really important insights into the patient's values. And now, although the problem was no longer indecision, now there was a different problem concerning how much pain the patient would have been willing to endure for the sake of this promise they had made. And so that had to be discussed with the family. In such cases, the ethics consultant will make an assessment of where the ethics issue really is and will make recommendations or suggestions in favor of a particular plan. The attending or other responsible physician is not obligated to follow these recommendations if they don't agree with the assessment. Thus, physicians do not have to worry that their hands would be tied once they've involved an ethics consultant. Finally, the ethics consultant will document their involvement and recommendations in the chart as appropriate. And depending on the case, the consultant might follow up to ensure that further assistance is not needed. Okay, but let's get very practical. So you know what an ethics consultant does, and you know how they do it, but how do you actually contact them? So at Norton Healthcare, the answer is to call the operator and request an ethics consult. The operator will pay to the chaplaincy service, since ethics is administered through their department and there's a chaplain on staff 24/7. The chaplain will respond to your request within 10 minutes in order to get basic information so as to determine whether this is an ethics issue or something else. If it's an ethics issue, it will be passed on and the appropriate individuals will be assembled, and an ethics consultant will reach out to you to begin the consult. During business hours, the ethics consultant will be in touch within 2 hours. But if the case is non-urgent and after hours, it will be handled the next business day. We always have someone available to take urgent ethics consult, no matter what hour of the day it is. As I mentioned earlier, anyone can request an ethics consult, including a patient and family member, any clinical or administrative staff. You do not need permission from a physician to put in a request. And we really encourage you to contact us, even if you are not sure you have an ethics issue or something, or if you're not sure ethics can really help. If that's the case, the chaplain will try to direct you to someone more appropriate. Normally, ethics requests are not anonymous, but if that is some kind of concern in this particular case, then this is something that can be discussed around confidentiality and how that could be managed in this situation. So when considering an ethics consult preventatively or just assessing whether the situation could merit ethics involvement, here are a few questions you can ask yourself. Are there interpersonal issues between the team and family and patient? Has the patient been here a long time? Has it been more than a month since the patient has had a family meeting? Is the patient very young or very old? This might indicate bias in favor or against aggressive treatment. Do you feel that the patient lacks understanding of their situation or is being coerced by family? This question I especially want to put out there for nursing staff who spend a lot of time with patients and families and might have a different perspective or appreciation for how patients are thinking through information. Do you feel like there's lack of clarity about the plan? Is the patient deteriorating quickly in a fashion that family are unlikely to expect? Are there significant cultural differences? Do family expectations seem irrational to you? Or at the bottom of it, do you feel distress or just ethical anxiety about this case? A kind of ick feeling that something is off or unjust, and you don't know how to put it, but it'd be really helpful if you had an ethics consultant come by and talk through it with you. And it doesn't have to become a full case. It can be something where you call and we talk about it, and that resolves the situation for now. And then we decide, you know what, but if you reach this threshold, if this starts happening, then call us again and we will try and find a solution that works. So these are all things to look for that might ultimately lead to an ethics issue down the road. Now, what about the case that Dr. Brothers mentioned? Well, using what we've just discussed in this discussion, we can see that the ethics consultant can assist in various ways, even in a case that is impossible. So they might be able to start helping with assembling the legal team in order to discuss, depending sort of where it is in the case, what the legal options are for a child, what the sort of policies are in the hospital that can highlight anything that can help the situation and the team. They can try and contact the parents and engage with them in a discussion about what would be best for their son. They can help clarify with the team and its individual members what they actually find distressing about the situation and help them express and label it so that they're not confused about their general feelings. The consultant can also remind them that although these restrictions can be unfair and that it is although the restrictions, like the legal restrictions they are facing, are unfair, it is not their ethical duty to put their job on the line or to do anything that could violate a law or policy, since that would prevent them from serving many other patients that need them. And I think this is sometimes where the distress comes in, where they do know that they wish they could do something that they are restrained from doing, and knowing that they don't have to feel that they need to do that is important. The consultant can also help shift the team's attention away from what they cannot do to what it is in their control, such as managing the patient's pain or having the authority to refuse to provide treatment which they do not deem medically beneficial, such as cardiac resuscitation. So in the last few minutes that remain, I'm going to turn the floor back over to Dr. Brothers so he can tell you how the case was resolved.
So we were consulted when this baby was 5 months old, and there was no fixing the problem, right? The team had a baby that they were taking care of, who they viewed as suffering, but there was no way to end the child's suffering. And so we talked about it. We sort of did debriefings. We explored the options. We actually were all together on a Zoom call waiting for a judge to join, and it never happened. So 2 months later, we were reconsulted. The family had had conversations with the team very infrequently, had continued to want everything. And we were being reconsulted because the baby was starting to show signs that he was going to die soon, and they didn't know how to handle that. The family had told them to do everything. So I came into this quiet part of the NICU where they had moved this baby. And there was this very courageous nurse who had her phone hooked up to a speaker that she had brought from home, and she played music for him all day long. And every time she was on, she was his nurse, and they showed love and attention to this boy who couldn't move for months, despite the fact that his parents were never there and no one was making any decisions for him. So we talked through what were to happen if you were to code. Would doing resuscitation be obligatory? And we talked about what would be the medical purpose of that and what are the legal boundaries. And so the team talked amongst themselves, and they decided that if you were to code, it would not be medically indicated to do resuscitation on him. So that weekend, he died peacefully. Yeah, you're gonna moderate. Yeah.
Well, we have covered some ground this evening. Question and answers. Well, questions and responses. How about that? I'll set it up that way so you don't have to answer. And so Kelly's monitoring the 100 some odd people in the virtual world, and here we are. So what questions do you have for our panelists?
Question. Since the duration for an ethics consult takes a necessarily considerable amount of time, how do you recommend staff proceed in situations where time or the environment is constraining, such as in the emergency department? In this setting, ethical conflicts are abundant, but ethics consultations do not seem to be a realistic option. This seems like a significant gap where conflicts are not satisfactorily resolved and staff are left.
It's got Dr. Schumann written all over it.
Well, I've heard debates. Some people say that there's no such thing as an ethics emergency, in the sense that if there hasn't already been something put in place beforehand, it's a little too late for ethics. In my previous role, where I did hundreds of cases, I never received a consult from the emergency department. I don't know what that says. It's something about in that moment, if it's really an emergency and you have 1 minute to make a decision, then it's too late even for an ethics consult. But if you have an hour, then absolutely give us a call, and if it'll be clear that it'll be urgent, and we'll try to get back to you as quickly as we can.
I once had one. I had an ethics consult from the emergency department. I talked to the doctor and I went and got in my car and drove to that hospital. And the consult was finished before I got to the hospital because we were able to resolve it by talking on the phone. So yes, no, it's good. No, she reached back calling an ethics consultation, and it was a pediatric situation. So the consultant actually came around the corner and said, we have a pediatric emergency consult. Can you help? So that's how, basically handed off the phone, and I talked with them. So we're always available. We had ethics consult this past Sunday morning, and we helped. So we'll be there for you. The emergency department, oftentimes you just sort of like fix the problem and then figure it out later, but there are ethics consults there, and we will do them. And so you should give us a call.
Just this is for Dr. Schumann. Just a continuation of that ethics in the emergency room, have they been studied? And if like in this case with that question, what will be the best method for Norton Healthcare to look at the ethics issue in the ED? Ask the physicians, ask the staff what's going on, and put policies and preventions in place?
So your question is, what kind of research is there around ethics in the emergency room, and what could Norton Healthcare do to try and address ethics issues in the ER?
Exactly.
Oh, that's great. I actually don't know much about the research on ethics cases in the ER, so maybe Dr. Brothers has something to add to that. But I think that as part of our goal to try and strengthen our ethics service and make sure that we are meeting all the needs throughout all of our hospitals, I think surveying the physicians and trying to identify what kinds of issues they're encountering and what kind of policies and practices we can have to prevent these issues, to educate. I think that's the best we can do. But if you have other ideas, I'd love to know.
We'll talk.
Yeah, I don't have anything more beyond what Dr. Schumann was saying, but I do think, you were saying if it's not put in place already, then, is ethics really going to help? And I think one of those things to be put into place ahead of time is education. And so Esper, we've done education for emergency medicine physicians on ethics issues, and they're very common. And so sort of equipping folks to handle those situations in the moment without a consultation is really like a critical thing to put into place.
Sounds like it's for Dr. Brothers. What decisions were made regarding the use of highly expensive and marginally beneficial medications over the intervening months?
Yeah, so the session tonight wasn't about that, so I didn't get into it. There was a decision to, the first consult was actually about, hey, we have this $150,000 treatment to give on Monday. Should we do that? The parents wanted everything. We decided the factor of money does play into decision-making in medicine, but at the system level, not at the bedside. We don't make decisions about whether something should or should not be done based on how much it costs. We make decisions about whether or not it can help the patient. In this case, nobody believed it was going to have a significant benefit for the patient, but the decision had been made at the beginning. We're going to give 3 doses of this treatment, $350,000, and we will then assess whether or not it had the effect that we were looking for. So they actually proceeded to give the treatment, and the medication had expired before they could give it. And so, you know, the real world gets in the way sometimes. So there was, I think, a second dose given at another time.
Before Greg comes to do the final closing, I'd like you to know that you're all entered into a drawing for a free truck.
I would add that trolley does have a brake. I can first of all thank each of our speakers for tonight's program. Thank you. There's one word that comes to mind for me when I think about the program, and that's just simply wow. Right, wow. It was very powerful, thought-provoking, and as advertised, sometimes emotionally draining. But it was a very, very good program. I'd like to remind everyone, as some of the questions at the end alluded to, that ethics consults can be very important and very beneficial in many ways for the patients, for the families, and yes, even for our staff. I'd like to let the audience know, both of you who are here and out there in Zoom land, that you will be receiving a link for program evaluation. And I think you would agree that each of our speakers certainly deserve for you to take a few minutes of your time and tell us what you think about tonight's program. Again, thank you for attending either in person or virtually, and God bless each of you, and safe travels this evening.